Blood pressure is the force of blood pushing against the walls of the arteries. When this pressure gets too high, we refer to it as hypertension or high blood pressure. This is a serious condition that can lead to heart disease, heart attack, heart failure, stroke, kidney failure, or other serious medical problems if left untreated. You may have heard high blood pressure referred to as the silent killer. The reason for this is because most patients are actually completely asymptomatic. Some symptoms that you may experience, however, are headache, dizziness, and blurred vision. But keep in mind that most patients may not even realize that they suffer from high blood pressure until they suffer from more serious complications such as heart attack or stroke. There are several risk factors for high blood pressure. Some of those risk factors include age, gender, obesity, inactivity, ethnicity, and family history. As you increase in age, your risk for developing high blood pressure increases as well. Males are also more likely to develop high blood pressure than females. If you have any immediate family members who suffer from high blood pressure, your risk may be increased from that. And also certain ethnic groups have higher chances of developing high blood pressure, such as African Americans, Asians, and Hispanics. Again, remember, most patients with high blood pressure are completely asymptomatic. Therefore, high blood pressure is usually diagnosed at a health screening or at your primary care physician's office with routine blood pressure checks. That's why it's so important to follow up with your primary care physician regularly. A normal blood pressure is considered less than 120/80. However, if you have blood pressure readings that are consistently higher than this, you may be diagnosed with high blood pressure. We usually consider hypertension a blood pressure reading of at least 140/90 and many times even higher. The first step in treating high blood pressure is what we call lifestyle modification. This includes adhering to a healthy diet, which usually we recommend decreasing the sodium in your diet. My preference is to less than 2,000 milligrams or 2 grams of sodium a day. That's 1 teaspoon of salt a day. We also recommend having a diet high in fruits and vegetables and fiber. There's a diet called the DASH diet, or a dietary approach to stop hypertension, which I recommend to most of my patients who suffer from high blood pressure. Other things that can help lower blood pressure is regular exercise. I recommend at least 30 to 60 minutes of moderate aerobic exercise a day for most patients. However, you should consult your doctor before making these kind of changes. I also recommend decreasing your daily alcohol intake and also making every attempt to quit smoking. If your blood pressure is unable to be controlled with these measures, sometimes you may require medications to help treat your blood pressure, which of course would be done under the supervision of your primary care doctor. Getting your blood pressure under control is very important. Although you may be feeling fine, keep in mind that again, blood pressure can still be causing serious damage to your body. So it's very important to follow up with your healthcare provider and take any medications that have been prescribed to you as instructed. In most cases, high blood pressure can be managed by your primary care physician. If you have particularly difficult to manage high blood pressure, you may also require the assistance of a cardiologist and in some cases even a kidney doctor. If you do not currently have a primary care provider, NORTHOAKS would be happy to assist you.